Before you read another word, do something for Dr. Pradeep right now. Take off one sock. Just one. Look at the skin where the elastic band sat against your leg all day. If you can see a clear groove pressed into your calf, an indentation that lingers for 30 seconds, a minute, sometimes longer before the skin finally levels back out, then what you are looking at is not a sock problem. It is not too much salt. And despite what the majority of people over 60 have been told at doctor's appointments for decades, in most cases it is not a heart problem either. It is a drainage problem. And the system responsible is one that almost nobody has ever sat down and properly explained to you. The fluid is already in your leg right now, perhaps half a liter, perhaps a full liter, pulled quietly into the soft tissues around your ankle and calf while you sat today. And tonight, when you lie down to sleep, that fluid is going to do something to your body that fragments your sleep, loads your heart with unnecessary work, and accelerates every health challenge you're already trying to manage. Dr. Pradeep is going to show you exactly what is happening inside that ankle and the 5-minute evening habit that drains it before it can cause any of that damage. You know the feeling. You come home, you pull off your shoes, and there they are. Ankles that are visibly thicker than they were this morning, calves that feel tight and leaden, rings that have stopped cooperating. You press a thumb into the skin above your ankle bone and watch it leave a small white crater that takes an age to fill back in. You get up after sitting for an hour and your legs feel as though something has been poured into them while you were not paying attention. And when you bring this up at a medical appointment, what happens? You are asked about your heart. You are told to reduce your salt intake. You may be handed a prescription for a diuretic, a water tablet designed to make you urinate more frequently. And for some people, that provides modest relief. For the majority of adults over 60, it does almost nothing, because the water was never inside your bloodstream to begin with. It was in your tissues. And a diuretic can only draw fluid from blood. It cannot reach the tissues. So the water stays exactly where it was, while you spend your days rushing to the bathroom unnecessarily. You have been treating the wrong compartment entirely. Dr. Pradeep is going to fix that. Your body does not have one drainage network. It has two. Almost everyone knows about the first, the cardiovascular system. Arteries carrying oxygenated blood outward, veins returning used blood to the heart. That system has a dedicated pump that runs every second of your life without any conscious input from you. The second network is called the lymphatic system. And here is what nobody explained. It has no pump, nor the reduced pump, nor the weaker pump, no pump at all. Lymph is a pale, clear fluid that continuously seeps out of the tiny blood vessels throughout your tissues, surrounding your cells, collecting cellular debris, metabolic waste, excess protein, and excess water, and then returning all of it to the bloodstream through a completely separate network of vessels called lymph capillaries and lymph ducts. Your body moves roughly 2 liters of this fluid every single day, but those lymph vessels have nothing driving them except one thing: your movement. Every step you take, every contraction of your calf muscles, every flex of your ankle physically squeezes the lymph vessels and pushes fluid upward through a series of one-way valves toward the chest. Stop moving and the system stops. Sit for 3 hours and the conveyor belt comes to a complete standstill. Fluid simply accumulates in the tissues of your lower legs, 1 quiet teaspoon at a time, going nowhere. When you are younger, this is not a significant issue. The lymph vessels are supple and elastic. The valves inside them are crisp and competent. A short walk is enough to restart the whole system within minutes. But after 60, 3 things change simultaneously. The lymph vessels gradually stiffen, the valves begin to leak, and the loose connective tissue around the ankles, the structural matrix that supports everything, loses its own elasticity and starts to hold on to fluid more readily. Fluid seeps in faster, the system drains it more slowly, the mathematics stops working, and evening by evening, the reservoir grows. Before Dr. Pradeep goes any further, he wants to draw a clear and important line. There are circumstances in which ankle swelling is not a lymphatic issue and requires urgent medical attention today, not next week, not at your next scheduled appointment. Stop this video and see a doctor immediately if any of the following apply to you. One leg swells significantly and suddenly within a matter of hours and is painful, warm to the touch, and red. This presentation can indicate a deep vein thrombosis. It is potentially serious. Both legs are swelling and you are experiencing any difficulty breathing, particularly when lying flat, or you wake at night gasping for air, or you cannot climb a single flight of stairs without stopping. This pattern suggests cardiac strain that has moved beyond the early stage and is not appropriate for a home management protocol. You are experiencing swelling alongside rapid unexplained weight gain, 4 or 5 pounds within a week, combined with frothy or foamy urine. This combination requires blood work this week. Swelling on one side only that is painless, firm rather than soft, in someone with a personal history of cancer treatment in that region. This warrants evaluation. If none of these situations describe you, if your swelling builds gradually, affects both legs equally, is consistently worse by evening and consistently better by morning, and you have no breathlessness at rest, then everything that follows is specifically for you. Chronic lower leg swelling after 60 generally falls into one of 3 distinct patterns that look nearly identical from the outside but have entirely different causes. The first is venous. The veins are struggling to return blood to the heart because the valves inside them have weakened and begun to fail. Blood pools. Pressure inside the vessels rises. Water is forced outward through the vessel walls into surrounding tissue. This pattern is typically accompanied by visible varicose veins and a brownish discoloration of the skin on the shin just above the ankle. The swelling is dramatically worse after a full day on your feet. The second pattern is lymphatic, and this is the one Dr. Pradeep is focusing on today. The lymph flow has slowed. The tissue is saturated with fluid that the system cannot clear quickly enough. This swelling is soft, leaves a visible pit when you press it firmly, and characteristically involves the top of the foot, the area just behind the toes. In people who have been dealing with lymphatic swelling for years, the skin on the top of the foot becomes so thickened that you genuinely cannot lift it between 2 fingers. That is a meaningful clinical indicator, and it points clearly toward lymph rather than veins. The third pattern is cardiac or renal. The heart or kidneys are not managing fluid volume adequately. The swelling is symmetrical and worsens through the day, but critically, it is accompanied by other symptoms: breathlessness, waking repeatedly at night to urinate, profound fatigue, and rapid unexplained weight gain. If this is your pattern, it is not a home protocol situation. You need a proper clinical evaluation. The majority of adults over 60 with chronic evening ankle swelling and no other accompanying symptoms fall into the second category, lymphatic. Dr. Pradeep wants to walk you through a story that will make the entire mechanism concrete. He will call this patient Thomas. Thomas is 70 years old, a retired civil engineer, fit enough, no significant cardiac history. For roughly 2 years, his ankles had been thickening as the day went on, at first only slightly, then enough that the shoes he had worn for years no longer fitted comfortably by mid-afternoon. He bought wider shoes. The swelling continued to progress. He raised it with his GP, who ordered an echocardiogram. The heart looked completely normal, excellent function, no structural abnormality. Thomas was prescribed a diuretic. He took it faithfully for 7 months, spent much of every day making trips to the bathroom, became progressively more fatigued and mildly dehydrated, and his ankle swelling barely changed. He was frustrated and confused. But one afternoon, almost in passing, he mentioned something to Dr. Pradeep that immediately clarified the entire picture. The strange thing, he said, is that on holiday last summer, we did a lot of walking, and my ankles were actually much better than at home. There it was. Swelling improved with sustained movement. Swelling worse with prolonged sitting. Heart confirmed normal. Kidneys confirmed normal. Veins on ultrasound showing only mild age-related changes. What Thomas had was a lymphatic drainage failure, and no diuretic on the market could address it, because the fluid was never in his blood to begin with. It was in his tissues. Pills work on bloodstreams. This problem required a different solution entirely. Here is what happens to Thomas every day, and very likely to you. He wakes in the morning. His ankles are relatively slim. He has been lying flat for 8 hours. Gravity has not been pulling fluid downward into his legs, and his lymphatic system has had the entire night to work steadily at clearing yesterday's accumulation. He rises, has breakfast, sits at the kitchen table, drives to the shops, sits at his desk, has lunch, sits in front of the television. By mid-afternoon, he has been upright but essentially stationary for 7 or 8 hours. Fluid has been leaking slowly from capillaries into the tissue of his lower legs continuously throughout that time. His calf muscles have barely fired. The lymph conveyor belt has barely moved. A quiet reservoir has been building, a teaspoon at a time, in a space he cannot see. By evening, the sock groove is visible. By 9, the ring is tight. By 10, he lies down. And now the compounding problem begins. With gravity removed, all that accumulated tissue fluid gradually reabsorbs into his bloodstream. His heart receives an unscheduled flood of extra volume. His kidneys detect the increase and shift into production, generating urine. He wakes at 2 in the morning. He wakes again at 4. By 6, he is exhausted. And tomorrow, the cycle begins identically. 2 quick assessments, 30 seconds total. The first is the pit test. Find the bony ridge along the front of your shin, approximately 4 inches above the ankle. Press your thumb in firmly and hold for 15 full seconds. Release and observe. If a visible indentation remains and takes 10 seconds or longer to smooth back out, you have what clinicians call pitting edema. A shallow dent that resolves relatively quickly is grade 1. A deeper dent that persists longer is grade 2. A deep, slow-clearing dent lasting over a minute is grade 3. Note your grade. You will retest in 2 weeks and the change will be measurable. The second is the foot skin pinch. Try to pinch the skin on the top of your foot, just behind the base of the second toe, between your thumb and forefinger, and lift it into a fold. If the skin lifts easily, your lymph is moving adequately. If the skin feels fused to the underlying foot and cannot be lifted at all, you have a clinically recognizable sign of chronic lymph congestion called a positive stemmer sign. Make a note of what you find. 3 things are making your lymphatic swelling worse, and most people over 60 are doing all 3 every day without realizing it. The first is hidden sodium, not the salt you add at the table. The sodium already present in cheese, cured meats, tinned soups, commercial bread, condiments, restaurant meals, and ready-prepared foods. Sodium draws water out of the bloodstream and deposits it into surrounding tissues, and your body retains approximately 4 cups of water for every extra gram of sodium beyond your needs. Most adults over 60 are consuming roughly double the sodium they believe they are. The second is sitting in the evening. The hours between 7 and 10 at night, the hours you finally sit down to rest, are precisely the hours when your lower legs pull in the most fluid. 3 hours of evening immobility after your largest meal of the day creates exactly the worst possible conditions for overnight fluid reabsorption and disrupted sleep. The third is alcohol. Even a single evening glass dilates the capillaries, increases the rate at which fluid leaks from vessels into tissue, and suppresses the hormonal signal your brain uses to slow kidney output overnight. One drink and the morning difference in your ankles will be noticeable. Now in the other direction, the things that actively support lymph flow. Water counterintuitively is essential. Most people with swelling reduce their fluid intake because the logic of less water in, meaning less water retained, seems sound. It is backwards. Dehydration thickens lymph, making it viscous and sluggish. Adequately hydrated lymph is thin and flows freely. Aim for roughly half your body weight in ounces daily, spread through the morning and afternoon, tapering meaningfully after 5 in the evening. Foods rich in natural flavonoids, compounds that strengthen capillary walls and reduce the rate at which fluid leaks into tissue in the first place, include dark berries, red cabbage, citrus peel, and buckwheat. A cup of dark berries daily has documented effects on capillary integrity over approximately 8 weeks of consistency. Dietary protein is one that surprises people. A protein called albumin circulates in your blood, and its specific job is to hold water inside the blood vessels. When albumin is low, as it commonly is in mildly protein-deficient older adults, water leaks out of the vessels and stays in the tissues. 2 high-quality protein servings daily from eggs, fish, chicken, lentils, or cottage cheese directly improves the physics of fluid balance. Magnesium, chronically low in the majority of adults over 60, is involved in the smooth muscle tone of lymph vessel walls. Pumpkin seeds, dark leafy greens, and almonds are the most accessible dietary sources. And now, the 5-minute evening habit at the heart of this video. In the morning, before your feet touch the floor, while you are still lying flat in bed, perform 30 ankle pumps. Point the toes firmly downward, then flex them back up toward your face. 30 repetitions. This takes under a minute. It restarts lymph circulation after 8 hours of stillness and prevents the sudden downward rush of fluid the moment you stand. During the day, every hour of sitting, perform 20 calf raises, either seated with heels on the floor, pumping the toes upward repeatedly, or standing and rising onto the balls of the feet and lowering back down. 30 seconds. This keeps the conveyor belt running throughout the day so that fluid accumulation is interrupted before it becomes significant. Set a timer on your phone if needed. Before dinner, take 5 minutes of slow, unhurried walking around the block, around the house, through the garden. Walking engages the deep calf musculature in a way that no seated exercise can replicate. The critical piece is what happens 90 minutes before bed. Lie on the floor or your bed and place your legs straight up against the wall at roughly a 90-degree angle, heels above hips, hips above heart. Remain in this position for 15 minutes. During the first 5 minutes, perform slow ankle circles, 10 in each direction, then alternating ankle flexes, 20 repetitions. Then, for the final 3 minutes, while still inverted, place both hands flat on your abdomen and breathe slowly and deeply through the nose, belly rising with each inhale. This is the piece most people overlook. Your thoracic duct, the central drainage vessel of the entire lymphatic system, runs directly behind your diaphragm. Slow, deep abdominal breathing physically pumps it. Every deliberate breath is working your lymph in a way nothing else can replicate from the outside. After 15 minutes, roll slowly to one side, sit up, and perform something unglamorous but genuinely effective. Using the flat of your fingers, starting at the ankle, stroke the skin slowly upward toward the knee in long, gentle, continuous movements, always toward the heart, never downward. 10 strokes on each leg. This is a simplified form of manual lymphatic drainage, and it physically guides fluid from the tissue spaces into the lymph capillaries where it can be transported away. Shortly after completing this sequence, you will feel a clear urge to urinate. You will pass approximately 300 to 400 milliliters of pale fluid. That is the fluid that would otherwise have reabsorbed into your bloodstream at 2 in the morning and woken you from sleep. You have just drained it while you were conscious and in control of the timing. Your heart will not receive that unexpected overnight load. Your kidneys will not scramble to compensate. Your sleep will be different. Thomas followed this protocol for 3 weeks. By the end of the first week, his sock marks were gone by morning. By the end of the second week, his nights were uninterrupted. By the end of the third week, his ankles at 9 in the evening looked the way they used to look at 9 in the morning. His echocardiogram had not changed. His prescriptions had not changed. What had changed was that his lymphatic system was being given the physical conditions it needed to function. Conditions it had been silently waiting for. 5 things Dr. Pradeep wants you to do starting today. Perform the PIT test right now. Write down your grade. Cut 1 source of hidden sodium tomorrow, whichever of cheese, cured meat, or tinned soup appears most often in your daily routine, and replace it for 2 weeks. Before dinner tonight, not after, before, take a 5-minute walk. 90 minutes before bed, legs up the wall for 15 minutes with 3 minutes of deep belly breathing and 10 upward strokes on each leg when you finish. Tomorrow morning, 30 ankle pumps before your feet touch the floor. Do all 5 for 2 weeks. Retest the PIT test. The change you find will not be subtle. Leave a comment below and tell Dr. Pradeep 2 things: how old you are and where in the world you are watching from. The age and location of this audience genuinely shapes which topics he covers next. And if someone you care about has been living with swollen ankles and has been told repeatedly that it is their heart, send them this video. They may have been given a diagnosis that does not fit their actual mechanism, and a pill that cannot possibly reach the compartment where the problem actually lives. This 5-minute habit can. Your ankles are not failing you. They are a drainage system that stopped receiving the signals it needs to run. Give it 5 minutes each evening and the difference will show up in the mirror, in your shoes, and in the first morning you wake up and realize you did not press your thumb into your calf to check. Please subscribe to this channel and share this video with someone who needs it. Dr. Pradeep is here every week with the kind of detailed, evidence-based explanation that you deserve to have and that your legs have been waiting for.